My name is Dr. Crowder. I'm also known as Dr. V, which makes my name very simple. I'm an emergency medicine physician. I've been practicing now for 30 years. And you can follow me on Twitter at AskDrV. And all of the source documents, as well as the invites and a taping of this, will be on AskDrV.us. The goal is to actually keep everyone informed of COVID-19 science to help them and their families stay healthy during this pandemic. And the outcome of this webinar is that everyone's motivated to create an action plan for themselves and their family. For some people, they may be creating an action plan for a broader community, like a union or a workplace or a homeowners association or something like that, right? All right. So just a little bit about what is a pandemic. A pandemic has to be an infection that's contagious. So it can't be a cancer or heart disease or something like that. So it's an infection that people do not have immunity to. Examples are polio, tuberculosis, smallpox, HIV, bird flu, SARS. These are all examples. We've actually talked about a little bit about how we, oh gosh, hold on just a second. I'm actually in a wrong presentation. Hold on just a second. I apologize. I apologize for that. All right. There we go. I'm sorry, I was doing more than one presentation today and we didn't change the date on this one. So I apologize for that. Hold on just a second. All right. We're going to take questions in the chat box or also in the Q&A. All right. So we went over the intention and outcome, went over what a pandemic is. All right. So we have now crossed over the 200,000 deaths in the United States. Had we responded to COVID-19 the way Canada did, we would have had about 100,000 deaths right now at this point in time, right? Looking back at literature and hospital admissions and clinic visits, it looks like we saw an uptick in respiratory illnesses as early as December. So it looks like we were actually seeing COVID-19 in December. It's really important. We don't really have a very good public health system, an early detection system. You know, it's more important that we actually knew in January that we were seeing an uptick in respiratory symptoms rather than now. But that's kind of like the benefit of an early detection system. It can kind of tell you something is on its way and something is coming. Dr. Fauci has warned that 7 states should actually be on alert and possibly go on lockdown. Those are South Dakota, North Dakota, Iowa, Arkansas, Missouri, Indiana, and Illinois. These 7 states are seeing very high surges in cases. There are 3 very high-risk places that we found when you talk to people and say, you know, you've caught COVID-19, what did you do in the last 2 weeks? The high-risk places are bars, restaurants, and gyms. And if you asked me to come up with 5 places, I would follow that with church, which includes funerals or weddings, and also some sort of airline flight. We've had, there was money that was meant for masks and swabs that wound up being used for jet engine parts and body armor. This is kind of unfortunate because we really do need to have the supplies that we need for not only ourselves and our family, but also in the hospital setting. The latest news has gotten even wilder with JFK grandson being a whistleblower. I don't know how he wound up on the Jared Kushner's COVID-19 task force, but this I thought was a really interesting article that came out of Town and Country. There were a couple of questions before about liability protection. There's been a lot of states enacting COVID-19 liability protection, and these liability shields vary from state to state. And basically what they do is they protect healthcare companies and certain businesses from being sued by people who actually contract the virus under a specific set of circumstances. There's been a lot of flip-flop on the CDC with people, initially they said asymptomatic people who had COVID-19 should not be tested. Then they said they should. Then they acknowledged that it was COVID-19 was aerosolized, and then they said it wasn't. One thing that I actually think is really important when you see this sort of flip-flopping, whatever is the most serious indicator is usually the thing that is correct. So for instance, should asymptomatic people who've had COVID-19 get tested or not get tested? Yes, they should. Is the coronavirus aerosolized and droplet? Yes, it's both. So one thing that I've noticed is that when you see the corrupting of the science, it's usually to sort of make you think that things are less serious than they are. And you need to always realize that the more serious news is really the more accurate. Under Obamacare, vaccines are required to be provided for free. 21 million people are insured by Obamacare. There is a Supreme Court case to overturn Obamacare that the Justice Department has brought that will actually be heard on November 10th. So what do you need to do if you think you might have COVID? How is it diagnosed? So it's mainly diagnosed by PCR testing, antigen testing, and CAT scan findings. So PCR testings are nasopharyngeal swab. Those are best, most accurate 8 days after exposure. Then the antigen test is a rapid test that detects proteins on the surface, and that is negative when it really should be positive about 20 to 30% of the time. So normally if we do a rapid test before we say somebody's negative, we'll do that test twice. You can also diagnose someone by CAT scan. We have had people where their test has been repeatedly negative, and then we actually diagnose them by CAT scan. As I've said here many, many times, respect COVID-19. It's highly contagious. It only requires 45 seconds of exposure to actually infect others. And if 100 people come in contact with COVID-19, 60 to 80 of them will become positive, as opposed to the flu, which is like 30 to 40. It can transmit by droplet and airborne. We originally thought it was only a droplet disease, which is why we originally told people to stay 3 feet away from each other. We now realize that it's both droplet and airborne. This is sort of a schematic of sort of what that looks like. Measles is airborne, and as you see, it can travel much further. So it's really, really important that people stay 6 feet apart and wear a mask. It's not 6 feet apart or wear a mask. It's important that you stay 6 feet apart and you wear a mask. If you have a home nebulizer, you cannot tell the difference between asthma and a COVID-19 attack. So it's important if you live with others to either use it outdoors or on a deck or in a garage with the garage door open, or you can use a spacer or inhaler. They've identified 6 clusters of COVID-19 symptoms. These clusters are listed here. Cluster 1, 2, and 3 are flu-like symptoms with or without a fever, and also gastrointestinal symptoms. People don't realize that COVID-19 is not just a respiratory disease. It also can present with nausea, vomiting, and diarrhea. Cluster 4, 5, and 6 are usually the ones that have to be hospitalized or end up in the ICU or actually die. And those are associated with fatigue, confusion, or a combination of abdominal and respiratory symptoms. So what do you do if you just found out you're COVID-19 positive? You want to quarantine, preferably for 21 days. In a quarantine room, you'd want to have a pulse ox, which is something that you can buy on Amazon for about $20 to $30. I recommend that everybody, whether or not they're COVID-19 positive or not, take zinc and vitamin D3 supplementation. These supplements have been found to actually make the disease less severe. You should have a bathroom that only you use, a cell phone so that you can call for help. And then you want to keep the windows open or have some sort of a HEPA filter. Now, just a little bit about masks. Peter Tsai invented the N95 mask. The N95 mask includes electrostatically charged fabric on the outside of the mask, which really attracts virus particles like a magnet. So that's why you really don't want to touch the outside of the mask. He recommends 7 masks one for each day of the week, hang them up in between use. And then what happens is that in that week where it's hanging, any sort of virus or anything like that deactivates. CDC is recommending that you use a mask that does not have a valve. The valve allows you to breathe out, and if you have COVID-19 and you don't realize it, you would be breathing COVID-19 out into the air. So the no valve mask, which is to the right, is preferred. This mask is a clear mask, and it's been FDA registered, not yet approved. I'm on the waiting list to actually get this. This is an N99 active ventilation HEPA filter mask. It's by a company called Leaf. You see some people wearing neck gaiters. They're sort of like almost like a tube sock that you pull up and down. These have actually been shown to actually increase the transmission of COVID-19, so they are not recommended. Now, this was one thing that was very interesting. The CDC said masks may be better than coronavirus, better than a coronavirus vaccine. This is actually true. When you actually look at the effectiveness of mask wearing, 2 people wearing a mask is about 98.5 effective. What we're looking at as far as the vaccine, some of the vaccines so far, the initial data is showing them 70 or 80% effective. So masks in general may be more effective in the long run. There's been a lot of talk about deaths associated with coronavirus, but there's also post-intensive care syndrome, which is the impacts of being in the ICU for so long. A lot of people get renal failure and they need dialysis or transplant. There's also limb amputations, strokes, and then what we're seeing most is pulmonary fibrosis, which is shortness of breath and scarring of the lungs, which leads to kind of shortness of breath with walking or house cleaning. There is a significant toll on the minority population. 75% of COVID deaths under 21 are Black, Hispanic, or Indigenous people. So these are things to really consider when you're looking at what you want to actually create for an action plan for yourself and your family. There's been some talk about herd immunity. Herd immunity is when a significant portion of the population actually has immunity. So the herd actually has immunity. There's 2 pathways to getting herd immunity. One, natural infection, where 70 to 90% of the population gets infected, or a vaccine. And again, that also includes a majority of the population actually getting vaccinated. Herd immunity by people naturally getting the infection is not a very smart idea. So let's assume that 80% of the population would need to be infected. We have 330 million people in the United States. So that means by natural infection, you would need to get 264 million people to become positive with COVID-19 before you would actually have herd immunity. 6 million cases of COVID-19 have caused 183,000 deaths. 264 million cases would cause about 8 million deaths. So you can see something like that would significantly overwhelm our healthcare system and cause a lot of devastation before you would ever get to herd immunity. Sweden was the one country in Europe that actually tried to do herd immunity. They attempted it and it failed, and they reversed course because too many people were dying. In addition, with COVID-19, you can get infected again. So you do not get lifetime immunity from the COVID-19 infection. So looks like antibodies wear off in roughly about 6 to 8 months. We've already seen a reinfection of someone in Nevada. Now, a little bit about vaccines. This is the vaccine process from beginning to end. Exploratory is when you actually look at how the infection works. Preclinical is when you test it in animals. Both of these 2 phases were done actually with the SARS vaccine, and the SARS and the corona vaccine are very much similar to each other. And that's how come we were able to actually move a little bit faster on the coronavirus vaccine. Then there's phase 1, phase 2, and phase 3. Phase 1 is a small group of people, and you're looking at safety. Phase 3 is a larger group and randomized. Some people get the vaccine, some people get a placebo. And then phase 3 is 30,000 participants. Once it passes phase 3, then you go to regulatory review and approval, manufacturing, quality control, and distribution. Currently, we have about 60 or so vaccines that are in various stages of the pipeline. It's really important that all phases are actually completed because there has been some discrepancy between phase 2 and phase 3. So I know there's been some reports about, oh, could we let the vaccine out early? They actually did that in polio with devastating results. So all of the vaccine developers have actually pledged to complete all phases of their clinical trials and pledged safety standards. BioNTech actually looks like they're going to have a coronavirus vaccine that will be ready possibly by December. Now, you've heard about BioNTech and you've also heard about AstraZeneca. AstraZeneca actually had their study paused because of significant side effects. You really have to have enough people take the COVID-19 vaccine in order for it to be efficient and effective. One thing that's actually really important is right now, the COVID-19 vaccines from Moderna, AstraZeneca, BioNTech, these are 2-part vaccines. So you take the vaccine once, and then you have to take it again in either 21 or 28 days. Johnson & Johnson just entered phase 3 clinical trials with a 1-part vaccine where it's just 1 shot. Now, other people around the world are also in this race for a vaccine. And so one of the main ones is COVAX, which is 3 organizations kind of put together, CEPI, Gavi, and the World Health Organization. And COVAX basically has is working with all different types of organizations, UNICEF, World Health Organization, governments, NIH, etc., to discover, license, manufacture, and deliver a vaccine. The World Health Organization has 169 COVID vaccine candidates currently under development, with about 26 of these being in human trials. Now, one thing that's important for your decision making is to actually know how much infection is going on where I am. So the infection rate is actually divided into 3 areas: green zone, yellow zone, and red zone. Some places you will see a 4th zone, which is orange, but I consider orange and red to be the same. So red or orange has the highest infection rates. They have more than 100 per 100,000 people. And if you did 100 tests, more than 10 of them would come back positive. Yellow is between 10 and 100, with 5 to 10 tests out of 100 coming back positive. And green is the lowest. So this is really, really important to know. You can go to the website covidactnow.org. And that website, you'll see a map of the United States. You can click on your state, and then from there you can click on your county. But when you're looking at going back to school, etc., I think it's very important to determine your community rate of infection plus the age of your children and who else is living in your home. Do you live in a multi-generational household? These are all things that are very, very important. This is actually what the website actually looks like. A state is not all orange. They kind of aggregate the data, but if you click the state, you'll actually see all of the various color codes in the area. But this is actually what it actually looks like. This was put together by a nonprofit group of physicians. Other countries, what other countries have done is, one, they've dramatically decreased their community infection rate. When it came to schools, they decreased class size. They moved desks 6 feet apart. They got rid of public water fountains. They provided PPE for instructors. They did universal temperature testing, and they cleaned more frequently. This is a COVID risk chart that was put together by the Texas American Medical Association, and it kind of gives you some idea of what are the things that are actually more risky versus less risky to do. So the riskiest things would be going to a large concert or going to a bar. Next would be going maybe to a movie theater. Lower on the risk would be going to the beach or going to a backyard barbecue. Even lower on the risk would be eating at a restaurant outside, spending an hour at a playground, grocery shopping, golfing, getting restaurant takeout, or playing tennis. And they have the lowest thing here as opening mail in your own home. It's really important that we realize that we really have to have a plan that goes into next year. You know, if we're lucky enough to have a vaccine that really works by January or so, January or February, then we really need to be prepared that there's going to be a period of time where people need to get vaccinated. And it's going to take a while for people to get vaccinated. And so, if on the early side, I think we've got another year into this. We may have a near normal summer next summer. I want to first actually I think it's important if we look back and look at the shutdown. We prevented 60 million coronavirus infections by the shutdowns and the actions that we've taken to date. So I know there's a lot of us on the call, including myself, who've kind of grown weary of this and, oh my gosh, how much longer? But I want us to also acknowledge ourselves for the difference that it's made. We have prevented 60 million coronavirus infections in the United States as a result of all the actions that we've taken. That's really, really miraculous. All right, we're going to go to Q&A. All righty, let me actually take us off of the broadcast mode. All righty. Hello. I'm doing this from someplace new today. A little bit great. All righty. If you have a question, you want to put it in the chat box, or you can also you can put it in the Q&A, or you can put it in the chat box. All right. So we have our first question. The first question is, what are your thoughts about going to open venues like a car show at a fairground? That's actually a really good question. Yeah. So yeah, I think it's okay to go to something like that. I probably I would absolutely still wear a mask. As long as it's not something that would be too crowded, I think you would be fine going to an open air event. I probably would not buy food there, because again, as soon as you buy food or something to drink, then you have to take your mask down to eat or drink. And so I probably would not buy food, but I would go. Alrighty, next question. Hold on just a second. All right. Alrighty. Hey, Dr. V, why are more Western states who were initially low, why have they recently been elevated? Okay, very good question. Okay, yeah. So the reason why you're seeing a lot of the states that are actually kind of in the mountainous area that have actually been positive recently and had more infections is because a lot of those states like North Dakota, South Dakota, Iowa, they have meat packing plants. So the meat packing plants are really being a huge source of infection. Like I've seen, like where one meat packing plant will have almost 1,000 cases of COVID. So there's a lot of employees all in one local area, usually in a huge warehouse. They have thousands of employees. And they're becoming a really big source of an infection in the area. So that's why we're sort of seeing it in these rural areas. And the meatpacking plants are not providing PPE and not doing things to actually help their employees, unfortunately. All righty. Let's see. Okay. Another question. Can we have a copy of the PowerPoint presentation? Absolutely. So if you go to AskDrV.us, then this is recorded. This presentation is recorded, not including the Q&A. So the presentation itself is uploaded to the website, so you can go back there anytime. I also put it on YouTube. So I also put it on YouTube. So it's recorded, it's on YouTube, and it is on the website. So you can see it anytime you actually want to see it. All right, great, great, great questions. All righty, let's see here. All righty, let's see, any more questions? Let me just take a look here. Okie dokie, hold on a second. I have a question from Manju. Okay, Manju, I'm going to take you off of mute. Go ahead.
Hi, how are you?
Doing well, doing well. How are you?
I am good. Thanks for taking my question. I figured it'd be easier to ask than type it out. So the question I kind of maybe I've confused myself and thought about it too hard. On the EPA list, you know, what is it, that list, F or N, whatever is like approved
Yes.
cleaners or disinfectants.
Yes.
So I know people put the EPA registration number in, and if it comes up, but then a lot of times, or every time that I've found on that list, it lists like one specific ingredient, and then the product name has a different name, and it's never the name that's on my product. And I'm like, does that mean it's not the right one? Or is it still valid because that EPA registration number started with those, you know, first few like 5 or 6 numbers?
Yeah. So it can be kind of confusing. I know, you know what, I didn't add this to the presentation, but recently they approved the ZEP products, which are in Home Depot and Lowe's. I would say if the registration number matches, then you're probably good. If the registration numbers match. Yeah, sometimes the labeling of the name is not exactly the same. Also too, you know I use some of the ones that are, they'll say some of them are related to the hospital grade ones. I normally get the hospital grade ones either on eBay or Amazon, and I find them all the time.
Okay.
Yeah.
Okay, perfect.
All right.
Thank
Great
you.
question. Yep, you're welcome. All righty. Here goes another question. Dr. V, how do you think we can get a larger percentage of people to cover their mouths and nostrils with their mask? You know what? You know, it's interesting. I do think that we are going to have a national mandate, a national mask mandate. And I also think that we are going to also have businesses require it. And I think also with the vaccines, we've never done an adult vaccination program. One of the reasons why kids really get vaccinated is because they have to go to school. I think you may even see things where people have to get vaccinated even to go back to work. So I think that for the mask, we're going to have to see it. It's going to have to be leadership. I think a national mask mandate, and also any states that actually do not have a mask mandate, you should make a difference on how much COVID relief they actually get. So there has to be consequences at the level of a governor for not doing a mask mandate. Okay, all righty. Let's see. Dr. V, a friend of mine told me that his daughter is a traveling doctor in Miami. They are treating patients with hydroxychloroquine. If myself or a loved one is offered this treatment, what should we or I do? So interesting. Okay, so most of the studies with hydroxychloroquine have been stopped. So I haven't seen, I don't know of anybody who's actually treating with hydroxychloroquine anymore. So I personally wouldn't take it. I would ask them why they're giving it to me and where are they getting this from, but I wouldn't take hydroxychloroquine. All the studies related to it have shown that it's not effective and that it actually can be harmful. So no, I would not take hydroxychloroquine. I would take remdesivir, which is an antiviral, which has shown some benefit, some mild benefit. All right, next question. Do you think the number of cases is really going down, or that people are just not getting tested as much anymore? So interesting. It could, I'm not really sure about that. One thing about it is I think that in the summertime, in general, you do see these infections go down a little bit. And then usually they ramp up again in the wintertime. So, and specifically, they usually ramp up around November, December, January, February. And so it's not surprising to me that the number of cases are going down. One thing that you can't get around with testing is hospitalizations. And if you look at the hospitalization rates and death rates, and death rate is more of a lagging indicator. You're seeing the hospitalization rate stay about the same. So I really do. I think we may be leveling off a little bit, but my concern is that the wintertime is coming, and the wintertime is going to be really bad because people will get influenza and COVID-19, or they're going to get RSV and COVID-19. If you haven't actually already taken your flu shot, it would be really, really important right now to get your flu shot. And CVS is giving it out for free. All righty. Any other questions? All righty. We got another question here. Yeah, all righty. This is actually a really good question. All right. How much does the average hospital stay with COVID-19 cost? I actually have not, that's a very interesting question. I will look that information up. I'm not exactly sure how much the average stay actually costs. But I do know that it really depends upon whether or not you're in the ICU or not. If you wind up in the ICU, bills are way past $100,000. Yeah, right. If you're in the ICU, just because of the level of care that's actually required at that level. I will actually find that out, and I will also find out the average length of stay in the hospital. I will find that out, and I will add it to the webinar for Tuesday. So I don't know that information, but I can look it up. Who can afford a long stay? Yeah. So this information right here about who can afford a long stay. So the problem that we have in our country is that our insurance, our health insurance, is attached to our job and not to our body, right? So if you have your health insurance attached to a job, then if you lose a job, you lose your health insurance. Well, what happens in the midst of a pandemic? People lose their job, right? So it's really not set up. I mean, we're really set up to be in the worst situation as a result of this. And I think this is why it's really, really important that we prepare ourselves moving forward and we switch our healthcare system over so that people's health insurance is attached to their body and not to their job. And that's why I brought up the whole thing about Ruth Bader Ginsburg and the Supreme Court. Because should Obamacare be overturned on November 10th, then you're looking at 21 million people that are insured by Obamacare that will become uninsured in the middle of a pandemic. So it really could have catastrophic consequences. All righty, let's see here. All right, any other questions? If so, type them on in. I'll give people a couple of more seconds here to type them on in. These are really, really good questions. I have to add some economic data to my slides for next week. All righty. Okie dokie. I don't see any more questions. All right. All right. Well, I want to thank all of you guys for coming. Please make sure to join us on Tuesday or Thursday. Feel free to invite other people or send the link around that you use to join. There is an invitation on the website that you can download and send to anybody that you actually, at the AskDrV.us website, that you can send around to anybody that you want to invite on this. And I look forward to talking to you all next week. Thank you for attending. All right, bye-bye.